Hello everybody and welcome to this month's video message. Now, you won't probably be able to recognise where I am by looking at the images. I'm actually in the Blanche Heriot unit, which is in Abu Wing and is the unit that provides genitourinary medicine to our local population. They want you guys to know they're here and you guys to be able to refer your patients, seek their support and help, and contribute to the patient-centred care we're trying to give to all our patients. So, over to the team. Hi Gillian.
Hello Suzanne.
Thank you for taking time to talk to me this afternoon. For the benefit of people who don't know, what do you and your team do down in Blanche Heriot unit?
Well, genitourinary medicine is sometimes known as sexual health clinic.
Okay.
So the main basic task is to look after people with any sort of sexual health problem.
Roughly, what is our patient population today, and what are the maybe new issues or presentations that are giving you cause
Well,
for
we
concern?
have about 1,200 attendances a month, of roughly split between men and women.
Yeah.
So we have obviously both genders, all sexualities. Chlamydia is common, warts are common, but with people very familiar now, if they've got daughters, that they're having vaccination for the human papillomavirus. We have a lot of things related to that.
Yeah.
So the pre-cancers, the cancers, oral cancers, genital cancers, anal cancers, we're getting quite involved with those sorts of things, and that's perhaps a big part of genitourinary medicine now. Herpes is very much alive and kicking, but the tests are much better. Nothing ever goes away. Syphilis is on the increase, gonorrhea is on the increase, and of course, as people will be aware from the media, the treatment for gonorrhea is more difficult because we're getting to resistance. We don't have a lot. So again, we want people to be treated, and we want the partners treated. So it's really a matter of seeing, identifying, and our health advisors do the most fantastic job at partner notification.
Okay. One of the things that I've observed over time is these services were quite insular, but actually you're very well connected. And it's the same principle. We're looking to deliver patient-centred care, and that includes everything and all of them and everybody, doesn't it?
Well, absolutely, because everybody is born as a result of some sort of sexual activity. Therefore, it's not something to stigmatise.
That's for sure. So I've been joined by Dr. Amy Bennett, one of the consultants down here in the Blanche Heriot unit. Hi Amy.
Hiya.
How are you?
Very well, thanks. Thanks for coming down.
One of the things that I didn't talk to Gillian very much about is the safeguarding responsibilities that you have and some of the complexity of the work that you're doing.
Yeah.
Just talk a little bit about that.
When I first started here, one of the things that I established quite quickly is that we don't have a dedicated service for under 18s. Now, under 18s are welcome here anytime, any service that we run really, 6 days a week. But it is quite important to try and identify certain times, particularly times after school or that might be more accessible for young people, where there's a dedicated service with the kind of appropriate staff members who are able to give quite holistic care. And we promote it as being a confidential service. We do have caveats to that safeguarding. We make that really clear about the confidentiality clause to all under 18s that we see, and there are certain times where we would have to break confidentiality to discuss with other professionals, social services for example.
So you're pretty well connected with the safeguarding team, with
Very
the rest of the hospital?
We have regular meetings with the safeguarding team, we undergo regular supervision, we contact the team for advice with any cases where we're unsure. We're unfortunately regularly having to make referrals whenever we meet young people who we have concerns about, and all of our team members here are really well trained when it comes to screening for things like sexual exploitation.
Do they come actually with physical issues, or are they looking for contraceptive advice, or
it's quite a mix. The majority are youngsters coming in for asymptomatic screening and contraception, quite a bit of emergency contraception, and that's often a really good point at which to initiate conversations about longer acting contraceptive methods as well. We do also receive referrals from other professionals, so sometimes from GPs and unfortunately sometimes from sexual assault referral centres and places like that.
Before we finish, is there anything you want to say to the organisation that's watching this film, your colleagues in the rest of the trust?
I think my message would be just be aware that we're here, be aware that we offer services for all ages, from paediatric cases right up to people in their 90s. We're open 6 days a week. It's a mix of appointments and walk-ins. We'll happily see staff and staff's children, and really just be aware that you can self-refer, really.
We want to hear from them if there's anything they think we can help them with. So if they think there's something, might be an infection, might be HIV related, But also we see a lot of people with some sort of genital problem that doesn't fit into gynae, doesn't fit into anywhere else.
Okay.
If it does, we can always move them on. So really it's to say, if you think it might be somewhere between the navel and the knee and it doesn't fit elsewhere, ask us.
So thank you to the team here down in the Blanche Heriot unit. I've really enjoyed hearing about the very special and important work that they're doing with a whole range of our patients and the local population. And of course, if you need any support or advice in relation to providing care for your patients or indeed your own family, they're here and they're only too willing to help.